So many tests for glaucoma, right? So let's today talk about that why are these tests being prescribed by your ophthalmologist to diagnose your glaucoma? Are they even important? Hi, I am Dr. Surbhi Taneja. I am glaucoma and cataract specialist at EyeMantra Hospital. So let's talk about the tests that are asked from the patients to get done when they are diagnosed with glaucoma. So first test that is done is by the ophthalmologist when you enter the office, that is the slit lamp examination. Now in this, your ophthalmologist will see the optic nerve, the main nerve that is going to send the visual signal from the world to the brain, and you are able to see. So now in such cases, what the ophthalmologist does is that he will check out the nerve. If the nerve is fine, then it's okay. But if they see any changes in the nerve that are present in glaucoma, they will tell you that they have a doubt of glaucoma. They won't confirm that you already have glaucoma, but they will tell you that yes, there is a doubt. Now, once the doubt is there, you need to get certain other tests done, which will help to confirm that doubt. See, now if glaucoma is present and it can be confirmed only with the test, then the medication is to be started as early as possible. Only then it can be controlled. So the first test that is done is the OCT. OCT RNFL is a test basically which gives a scan of your optic nerve. And it tells us that whether some of the fibers are dead or not and how many fibers are dead. So it is going to give us a proper knowledge about your nerve fibers. If some of the fibers are dead, that means early damage has started, and depending on other factors as well as correlating all the tests, medication might be started. The second test is a visual field test. Now, in glaucoma, the vision that first decreases is not your central vision, it is the peripheral vision. Slowly, as the glaucoma advances, the peripheral vision, it keeps decreasing, and ultimately the central vision is lost in advanced glaucomatous damage. So, to know whether someone has early glaucomatous change, these visual field tests needs to be done. Any loss of vision in the peripheral field will denote early glaucoma, and medication again can be started. Then the third test that is done is gonioscopy. Gonioscopy is a test that tells us about the angle of the interior chamber and also help us to diagnose whether someone has an open angle glaucoma or an angle closure glaucoma, because treatment of both of these diseases can vary a little bit. There might be a need of additional treatment in angle closure glaucoma. The next test that is done is the central corneal thickness or pachymetry. See, now the front layer of our eye, which is the cornea, it has a particular thickness, and that thickness is very important to correlate with the intraocular pressure that has been measured. Intraocular pressure that is measured could actually be overestimated if the corneal thickness is high, or be underestimated if the corneal thickness is low. So accordingly, the medication will be started. Another test that is to be done is the fundus photograph or your optic disc or optic nerve photograph. See, so what happens is today we took a photograph of your nerve, and down the line after 2 years, 3 years, we'll be seeing you again, right? So we will take those photographs again, and if there are any changes present clinically in your optic nerve, that could be documented and progression can be seen. If there is any progression in the glaucoma, that could be viewed through those fundus photographs. And of course, intraocular pressure that is measured every time you visit the ophthalmologist, that is given. And the main thing in this is that if you are a glaucoma patient, or if there is a doubt that you have a glaucoma, then intraocular pressure should be checked with applanation tonometer and not with the non-contact tonometer or NCT. The applanation tonometer is the one in which we put the dye in the eye of the patient, and then through a lens on the slit lamp, which is attached to the slit lamp, we check the eye pressure. Not the one where the puff of air, it comes into your eye and we record the pressure, that is the non-contact tonometer. So applanation tonometer is the gold standard for checking intraocular pressure in the glaucoma patients. So all of these tests, they are, when done together, will help in diagnosing glaucoma and confirming if the glaucoma is present or not. Then only we will start the medication. Now, the medication which started once usually needs to be put in the eye lifelong. So it's very important that all of these tests are done and we are able to diagnose it correctly, because we can't let the patient put eye drops for life. Therefore, whenever your ophthalmologist asks you to get these tests done, get them done without any hesitation, because glaucoma, if not treated on time, if not diagnosed on time, it can be a blinding disease and cause a lot of problems to the patient later in life.